Well, EMDR actually stands for something called eye movement desensitization and reprocessing, which is a bit of a long word really, for a technique that was originally developed in America to deal with trauma. And it has been found to be very useful in the treatment of war traumas, but also road traffic accidents, assaults, and people who've experienced all kinds of other incidents really in their life. There's still a lot of research going on into how EMDR works in the brain, but it seems that when people undergo a traumatic event, the brain has a reaction which kind of freezes it and stops it being able to process events that it would normally be able to do on a day-to-day basis. So EMDR works by using rapid eye movement, so creating a kind of bilateral stimulation, a connection between right brain and left brain. And when you move your eyes rapidly from side to side, there is something about that movement that seems to reduce anxiety in the brain. And when the anxiety is reduced, that seems to enable people to start making connections that can be really useful in helping them to understand the events that have happened to them. So it's not like hypnosis or anything like that. You remain completely conscious and aware the whole time, but you do find that some thoughts that weren't available to you before, maybe unconscious things, suddenly are available to you and can help actually make sense of the events that have happened. And in that way, it's a bit like being able to be a bit detached from what happened. So like watching a movie of something, or almost watching scenery going by on a train. And in that way, somebody can view what has happened to them in a way that is much less distressing to them, and they can start to make sense of, so that when eventually the EMDR has kind of processed everything, they're able to look back at that memory in a way that doesn't cause them any distress at all.